Thanks for your interest in learning about our unhealthy alcohol use study. I'd like to take a moment and share with you some of the important pieces of the study, including what we're asking of practices, what the enrollment timeline is, and then what the benefits are for the practices. We are specifically interested in recruiting 125 primary care practices across the state of Virginia. Once practices are enrolled, they'll be randomized to either control or intervention. Both arms will receive the intervention, but control will receive it at a delayed time interval. Each practice that enrolls will be provided a practice facilitator to work with them specifically in their own clinic, develop a workflow to screen for patients with unhealthy alcohol use. We'll work with the team in developing a counseling process, and we'll teach about brief interventions as well as medication-assisted therapy. We know that we're not doing this well as a community. Only 13% of patients are screened formally for unhealthy alcohol use, and of those that screen positive, less than 7% receive treatment. So what are we actually asking from the practices? We'd like them to designate a group of 3 or 4 leaders who can come together for learning collaboratives where they develop their own workflow and processes for managing screening and interventions. We'd also ask that practices host practice meetings. This would involve the entire staff and could take place during normal lecture times or over lunch meetings, where we would provide education on the screening techniques, brief interventions, medications, and motivational interviewing. We would ask that practices start screening for unhealthy alcohol use. And then at several points during the study, we're going to perform chart review. This can be done by someone within the practice, who we will pay to perform chart review, or the VCU team members can do this. Finally, we'll be surveying patients. However, practices are not required to do this. The only requirement from the practice will be to generate a randomized list of those patients who need to be surveyed. We think this intervention offers some really unique benefits for practices. This is an organized and evidence-based way to intervene and offer a service that's already recommended by the United States Preventive Services Task Force. As part of the intervention, we've also collected local resources that are specific to the area and geography of each location. This is going to be a long-term resource that practices will have access to after the completion of the study. They'll also receive one-on-one support from a practice facilitator to make sure that this process is the best it can be within their workflow. Finally, CME and MOC is available for all the participating clinicians in the study. Thanks for listening in and considering working with us on this exciting new project. We are happy to answer any questions that you have or talk with you further about the study. Thanks.